Hello, everyone. Thank you for joining tonight's call. My name is Ray McCabe. I oversee youth engagement at UNA USA, and we are very excited to have you all join us for our very first development session for our Declaration of Human Rights by American Youth. So this will be the first of many, many sessions across a variety of thematic areas relating to human rights, but we're so happy to have you all join us for our first one, which will be all about health and well-being and mental health and sort of the role of youth in advocating for health and human rights. So the way tonight will work, I will be in the chat and I'll be dropping in a few important links about, more information that you can learn about our declaration and how to get involved, as well as dropping in some information about our wonderful speakers that we have lined up for tonight. And later on in the program, we'll have ample opportunity for questions and feedback from the audience members. So feel free to leave your questions for later on, but if you do have questions and comments, feel free to use the chat, and I'll also be in the chat answering some questions as well throughout the night. So without further ado, I'm very excited to hand it over to our 11th Youth Observer to the UN, Himajah Nagaredi. Himajah, the floor is yours.
Oh my gosh, thank you so much, everyone, for coming, for joining us. For people who are going to be watching this recording, thank you so much for watching the recording. We're really, really excited to kick off this incredible effort of creating a Declaration of Rights by American Youth with this incredible session on health and well-being. And as many of you know and feel, health and well-being is so crucial to our approach in achieving all of the Sustainable Development Goals beyond SDG 3. And youth advocacy, youth leadership in this movement really matters, especially now. We've seen that young people have really championed health and well-being by taking on leadership in post-COVID-19 pandemic recovery. Young people take the lead on food insecurity. Young people take the lead on addressing mental health issues that directly impact them and their peers. In many ways, young people are championing the changes that we need in this sector of health and well-being to achieve human rights and justice for all. And so really thrilled that we have an incredible panel of speakers that will be touching upon the work that they do in their own sectors. All of them are subject matter experts. Many of them are young people and youth advocates. So just so thrilled that we have representation across all sectors. We have our incredible FAO liaison office representative who works on youth issues. So we're just really thrilled to be here with you all to share some of these incredible speakers that are going to talk more about their work, and then we'll dive into the consultation where you all, as young people, will have the opportunity to directly provide feedback for our efforts to create a Declaration of Rights by American Youth, a really strong statement that showcases youth rights as human rights. So without further ado, I am so thrilled and honored to welcome you all to our first speaker of tonight, Vicky Vo. She's a Shot at Life champion and legislative coordinator and a student nurses at Penn champion. Vicky, the floor is yours, and we're also going to put your bio in the chat so that people can read more about the incredible work that you do. But without further ado, super excited to hear your insights.
Here, can everyone hear me?
We can.
Okay. Yeah, so hi everyone, my name is Vicky, and right now I'm currently a freshman and rising sophomore at UPenn. I actually just finished my first year today after my finals, and I'm basically studying economics and nursing. So for Penn here, I'm currently a student nurses at Penn legislative coordinator. I'll just call it SNAP for short. And then my job entails a lot of work on the nursing legislative side. So for example, this semester I helped write a resolution for SNAP to present at the House of Delegates at something called the National Student Nurses Association Convention. And then our resolution was over increasing awareness for the need for quality lactating spaces. And then it was passed in the House of Delegates, so that's a good thing. So in the future, there's going to be more lactating spaces in airports, in public places like that. And then that was a huge thing this year for us because it's very competitive to get something passed like that. And then other than that, I work on creating programming health issues and social policy and I helped coordinate like a Capitol Hill event for Pennsylvania this year. And then for Shot at Life, there was actually someone at the NSNA convention who worked there. So if you don't already know, Shot at Life is a campaign for increasing access to vaccines for children in developing countries. And then basically all you do is just like call or email your legislators about vaccines, increasing accessibility. And then as a nursing student in person, I really believe that vaccines are important for protecting children, especially in developing countries, to help prevent like diseases, disability, and even death sometimes. But then not all children have access to vaccines. So that's why like speaking to legislators allow like me and everyone else to have a voice and tell them the change they want to see. So I really think that's important. And then I do this work with SNAP and Shot at Life because I think it's really essential for our generation to be involved in these processes, especially regarding to healthcare. I mean, like this is the world we live in and we want change, so we kind of have to be the change. So that's my take.
I love it. Thank you so much, Vicky, for telling us more about your work. It's so fascinating to hear how you really championed advocacy at the policy level in your own communities, in your state, nationally. Just so incredibly inspired by the work that you do to bring health policy to the forefront. And we'll save Q&A for the end, so everyone think about your questions that you want to ask. I'm going to now quickly pivot and turn it over to our incredible next youth speaker, Shrihita Dasari, the executive director and co-founder of Project No Bounds. And you can read more about her bio in the chat. Shrihita, the floor is yours.
Hello, everyone. As Hima just said, my name is Shrihita Dasari, and as she mentioned, I am the co-founder and executive director of Project No Bounds. I'm also a college student, as Vicky was mentioning. I'm finishing up my first year at MIT, not quite done. We're in the final stretch with finals, but I'm studying brain and cognitive sciences and science, technology, and society on a pre-med track. As a prospective pre-med student, I've been able to pursue a growing passion in a very special intersectionality of healthcare research and equity. In high school, after hearing about COVID's impact on rising school absenteeism, due to menstrual product inaccessibility for young girls, as well as the oral health disparities within low-income regions, I founded Project No Bounds, which is a 501c3 nonprofit aiming to alleviate hygiene and personal care supply inequities in underserved communities. Thus far, we've grown to a network of about 500 volunteers and partnered with more than 25 organizations across 20 US cities to distribute tens of thousands of personal care supplies to thousands of individuals in vulnerable populations. These include youth in unstable homes, refugees from Afghanistan and Syria through partnerships with institutions like the International Rescue Committee, victims of domestic and sexual violence, incarcerated individuals, and homeless veterans, among other very at-risk populations. This all originated as our team of directors started an effort in the height of COVID to consolidate local solicitations of excess skin, hair, dental, and feminine hygiene products from hotels and dentist offices into various hygiene kits, distributing them to families of sick children, as well as the recovering homeless in Atlanta. Through continuous monthly projects, owing to the name Project No Bounds, we sought partnerships with diverse organizations aiding various at-risk individuals. Through this whole process, PNB has really opened my eyes to the sheer number of both the resilient populations affected by various debilitating conditions, as well as the gratification of multitudinous support, and might I say the bidirectional gratification of this support, which has fostered my own voice for hygiene advocacy. Another lesson that it has given me, something that's a little more important, is the power of amplifying the voice of younger generations, especially as we grow our own volunteer network of high school and college student hygiene equity advocates. But more than just amplifying these voices, I feel like it's truly paramount for youth to be able to translate these voices and come to the center of policy-driven discourse. As Vicky was mentioning, it's very easy to think of youth advocates as leaders of tomorrow, but until we take younger people from the stands and from the audience and place them at the center table, we'll really come to realize that working for future generations is the product of those same individuals leading the cause as today's leaders.
Oh my gosh, Shrihita, I think everyone is literally giving an applause. Just thank you so much for the incredible work that you do around championing menstrual equity, around championing these really important rights that disproportionately affect women and gender minorities. And so thank you for everything that you do to advocate for hygiene equity, which is truly a cornerstone of everything we talk about when we talk about quality of life and health and well-being. So thank you for everything that you do to lead this effort as an incredible female entrepreneur.